There are many different diseases and viruses across the world that have deadly effects on people, such as HIV/AIDS, malaria, tuberculosis, and meningitis. One that has been heavily fought against is polio. In recent decades, the World Health Organization, otherwise known as WHO, has taken an initiative to end this disease in all countries. There have been vaccines that have made it possible to wipe out the disease in certain areas of the world. However, most recently, an even better vaccine has been created that's believed to drastically help the remaining countries that are still battling with the disease. Polio is a contagious, historically devastating disease. The disease is spread easily because 95% of the people who have it do not generate any symptoms but can still spread it. It is caused by a virus that mainly lies in the intestines and human feces. It is spread from person to person, primarily through oral contact with the feces of an infected person. It is also spread through contaminated food and water, especially in areas with poor sanitation systems. Before the vaccine was created by Jonas Salk in 1955, the epidemic reached its height in 1952. During this time, nearly 60,000 cases with more than 3,000 deaths were reported in the U.S. alone. The virus was endemic in 125 countries and paralyzed 1,000 children daily when in 1988 the WHO and its partners formed the Global Polio Eradication Initiative to lead a drive to eradicate polio. Since 1988, due to mass vaccinations with the older trivalent and monovalent vaccines, there has been a 99% reduction in polio cases worldwide. However, despite these vaccinations, type 1 and 3 is still circulating in 4 countries: Afghanistan, Pakistan, Nigeria, and India. Due to this endemic in these 4 countries, scientists have created a new bivalent oral vaccine. The new double-strand polio vaccine is more effective than the single and triple-stranded ones. A study on the bivalent oral polio vaccine, known as BOPV, found it induced a significantly higher immune response than trivalent vaccine. It also knocks out type 1 in poliovirus with just one vaccination. The vaccine has already been used in India, Afghanistan, and Nigeria. In India, so far this year, there have only been 32 diagnosed cases compared to the 260 cases that were diagnosed around this time last year. The importance of eliminating the polio virus is crucial so that it will never be able to reinfect countries who have previously overcome the disease. Therefore, this new bivalent vaccine is helping WHO out in reducing polio outbreaks. It is also speeding up the process of eliminating the virus altogether, so that people of this world will have one less disease to worry about.